I'm Dr Hayley Dyke, so I'm a casual academic at the James Cook University here in Cairns. I'm working currently at the medical school doing some teaching and demonstrating. As part of my Masters of Public Health at the end of last year, I connected with a colleague, Sandra Downing, and the two of us are endeavouring to do a research project into the experiences of women in Far North Queensland with accessing the surgical termination of pregnancy service that we're doing through the Cairns Sexual Health Service. Both Sandra and I are very passionate about women's health and particularly sexual and reproductive health, and feel that it's an area in Australia that needs a lot more focus and attention. Particularly we were triggered by the decriminalisation of abortion in Queensland in October 2018. The decriminalisation of abortion in 2018 prompted the need for a medical and surgical termination of pregnancy service in Cairns that wasn't formally set up. So they set one up in 2018, and we found a year down the track that it needed some evaluation, and so we set out to do that. The idea behind the project is to get women's voices in Far North Queensland and their opinions on the service and how their experiences have been, in a way that we can give some feedback and improve those services so that women are telling us what they need so we can sort of shape a service that's much better. And to do that, obviously the research project we're doing has a lot of interviewing, and it's a lot of conversation, and we want mostly women in that conversation rather than us. And so to get that all down on paper takes a lot of work. So we need, people to transcribe this stuff for us. It'll need to be presented in many places, to the hospitals, to the health service, to the uni, hopefully at a conference, because we believe that some of the feedback provided here potentially could be applicable to the rest of the state, if not other services in Australia. So taking it to conferences can be a bit expensive too. So for those services, this grant is giving us a lot of help that we would otherwise have struggled. So there's a sister project happening through the Cairns Sexual Health Service and JCU that's looking at medical terminations of pregnancy, so taking tablets rather than going to hospital. But as far as a surgical procedure, so coming into the hospital for the day and having a procedure done, I'm not aware of any sort of evaluation services, any evaluation studies that have occurred for that specifically. So no, this is helping us to sort of break into that. Because it's a sort of study where we do interviews with people rather than number crunching or anything like that, we need a lot less, but we'd still love to have around 20 women would be fantastic. It's obviously a very difficult subject to talk about, and women have to kind of put their hands up and come to us and say we'd like to talk about this with you. So we're expecting that 20 may be optimistic, but we would love the more people that want to get involved, the better. One of the best parts of these sorts of research projects is that you get their words and their voice without identities. So a major part of that is the transcription service, which again this grant is helping us for, which is amazing. And part of that transcription process is that their words come down on paper, but then their names and their identities, their ages, all that sort of stuff is removed. I'm quite new to research myself. My colleague Sandra is very experienced with it, but this is certainly, it's been the easiest part of our journey so far, in terms of applying for things. It's the first part of our jigsaw puzzle that's come down. So yes, we're very excited that the project's been deemed worthy and important enough to attract a grant, and as I mentioned before, the things we want to use it for would be difficult to sort of fund out of our own pockets or asking other people. So it's fantastic, really excited.